You know, we're experiencing a surge now in COVID-19 cases like we have not seen before, and it's starting to place a strain on hospitals here in Kentucky.
In fact, this morning, UK Hospital announced 5 operating rooms will soon be temporarily closed to make more room for COVID patients. LEX 18's Conroy DeLuce joins us now from Lexington. He has more in today's big story at noon.
In Kentucky, the first patient of the pandemic was treated at UK Chandler Hospital. There's been a steady stream of COVID-19 patients here since, but in the past week, that number has risen to more than 70 a day.
In the next few weeks, hospital officials say they expect even more patients after people gather for Thanksgiving. There are 32 operating rooms at UK Chandler Hospital. Starting on November 30th, 5 of those will close. Despite the reduced capacity, the Executive Vice President for Health Affairs, Dr. Mark Newman, says that elective procedures will continue, employees will not be furloughed, and that unlike in April when elective procedures were postponed, there is an adequate PPE supply and even more knowledge of the virus. UK Hospital was the first to treat a COVID-19 patient in Kentucky. That was diagnosed on March 6th. A spokesperson told me that just 1 month ago, back on October 22nd, there were 38 patients at UK Hospital with COVID-19. A week later, 46. Yesterday, that number was up to 71. 19 of those are in the ICU.
If a post-Thanksgiving surge means that there are more than 90 patients being treated here a day with COVID-19, hospital officials do say that additional closures may be considered. Now, as for those 5 operating rooms, those will be closed starting November 30th, and they'll continue through the end of the year. In Lexington, Conroy DeLuce, LEX 18 News.